Over the last 29 days, Namibia's COVID-19 induced deaths saw an increase of 125%. This translates to 19 deaths. This brings the total number of people who died of COVID-19 to 4,049 since its advent in Namibia about 2 years ago. The Health and Social Services Minister, Dr. Kalumbi Shangula, says the number of hospitalizations has also increased.
The number of COVID-19 patients admitted to hospital increased to an average of 30 per day as compared to 17 reported during the preceding 26 days. However, the number of COVID-19 patients admitted to ICU has reduced from 9 to 7 cases currently. The recent increase in the number of new cases continues to be driven by the BA.4 and probably B.5 sublineage of the Omicron variants.
Namibia is currently battling its fifth wave of the pandemic, with active cases standing at 1,921. The current health regulations include the correct wearing of face masks in public places, as well as a maximum of 1,000 people during public gatherings.
The public is urged and encouraged to continue wearing masks, especially in indoor settings and aeroplanes. 2. Gatherings. The permitted number with respect to public gatherings remains unchanged at 1,000 persons per event. Education. Measures related to education are retained. A number of many positive cases were recorded among learners and teachers. Therefore, educational institutions are urged to remain vigilant by enforcing public health and social measures.
The provision of entering Namibia with a full vaccination status has been extended to non-Namibians as well. Travelers can now enter the country by providing proof of vaccination and not a negative PCR test result as before.
A person is considered fully vaccinated if he or she meets any of the following criteria. 1. Either received 2 doses of a 2-dose primary series vaccine, or received 1 dose of a single-dose primary series vaccine.
Accompanying children under the age of 12 years will no longer have to present proof of their vaccination status or a negative COVID-19 test result at the points of entry.
4. Health officials are strongly advised to avoid separating children from parents in event the accompanying children have not met the port of entry requirements.
The decisions to amend and maintain some of the regulations is based on continuous monitoring of the virus trajectory in line with the WHO protocols.